Okay, today we will be discussing about the spleen. Now, the spleen, this is a hemolymph organ. In the fetal life, the spleen is responsible for production of erythrocytes, and after the birth, the spleen starts the formation of lymphocytes. So, because it is forming erythrocytes as well as lymphocytes, it is known as a hemolymph. Now, the spleen is usually located in the upper left quadrant. The maximum part of the spleen is present on the left hypochondriac region, and a small part extends into the epigastric region or the epigastrium. Now, the spleen is a structure which is sandwiched between the stomach. The stomach will be present over here. The fundus of the stomach is present somewhere over here, and the diaphragm. Alright, so the spleen is a structure which is sandwiched between the stomach on the middle side and the diaphragm on the lateral side. The first thing that we have to understand is how to hold the spleen in the anatomical position. So the spleen is present in the left hypochondriac region, so it is present somewhat over like this. The anatomical position of the spleen is somewhat like this. The spleen consists of an anterior end which is directed laterally, forwards and lateral. It consists of a middle end which is directed, or it consists of a posterior end which is directed backwards and medially. Okay? The spleen follows the rule of odd numbers, which means it is 1 inches in thickness, 3 inches in breadth, 5 inches in length, 7 ounces in weight, and is related to 9, 10, and 11 ribs. So 1, 3, 5, 7, 9 to 11, these are the odd numbers which is related to the spleen. So the spleen consists of two surfaces. This is the diaphragmatic surface which is resting on my palm, and this is the visceral surface. The diaphragmatic surface, as the name suggests, is related to the diaphragm. The spleen is separated from the diaphragm by a recess of the greater sac. More laterally, it is going to be related to the left lung and the costodiaphragmatic recess and the 9, 10 and the 11 ribs. On the middle side, we can see certain impressions present. So the largest impression which is present on the upper part is known as the gastric impression. So the fundus of the stomach is present over here, forming the gastric impression. So always remember, the gastric impression is present on the upper side. On the lower part, we have the renal impression. So the left kidney is related to the spleen over here. This lower section is related to the colic impression, because here we will have the left colic flexure, and a small triangular area over here will be related to the tail of the pancreas. So these are the relations of the visceral surface. The spleen consists of three borders. We have the superior border, we have the inferior border, and we have the intermediate border. How do we identify which one is the superior border? The superior border presents notched areas. Here you can see we have notched structures which will not be present on the inferior part. These notched structures, or the notched area, indicates that the spleen has been formed by multiple lobules during embryological development. So this is the superior border, the inferior border, and the intermediate border. The spleen consists of two angles. We have the anterobasal angle and the posterior angle, or the posterobasal angle. The anterobasal angle is the angle which is formed here, the meeting point of the superior border and the anterior end. So this is the anterobasal angle. The posterobasal angle is the point where the anterior end meets the inferior border. So anterobasal angle and the posterobasal angle. The anterior end of the spleen is always present around the mid-axillary line or behind the mid-axillary line. So we have to understand that this spleen does not come in front of the mid-axillary line. So it is not palpable when it is in normal condition. But if there is splenomegaly, or if you can palpate the lobe of the spleen, this is the point which basically comes under our fingers. So the anterobasal angle is also known as the clinical angle of the spleen, because this is the part which is the first part that we can palpate during the case of splenomegaly. Okay, in the intermediate border, the structure that you can see over here is known as the hilum of the spleen. This is the hilum of the spleen. The hilum of the spleen consists of structures which are basically the splenic artery and the splenic vein, along with some nerve supply and the lymphatics. The spleen is related to two different ligaments, that is the gastrosplenic ligament, which will connect the fundus of the stomach with the spleen, and the lino-renal ligament, which will connect the left kidney with the spleen. Now there is one more ligament which is present on the inferior side, which is known as the phrenicocholic ligament. So the phrenicocholic ligament, it is an indirect support provided to the spleen, for which the spleen is not able to move downwards. That is why the phrenicocholic ligament, since it is sustaining the spleen in its own normal position, the phrenicocholic ligament is also known as the sustentaculum lenis. So these are all the structures